Hey, buddy, time for the Daily Dose. I'm using AirPods, so I want to make sure you can hear me. So please let me know if you do. I am watching the Restream chat so I can see what you are staying here and interested to discuss whatever you guys would like. Good evening. It's actually afternoon here in Los Angeles. Hi, guys. Can you guys hear me okay? Are these AirPods working? Is the sound okay? Okay. Hey, now? You can hear. Good. Okay, great. How's the quality of the sound? Quality okay? Sounds fine. Okay, good. So yeah, I'm here at the Corolla Enterton. What is it? The his garage essentially, and this is leftover from the man show over my head here. Is there treatment for sleep paralysis? Yeah, there are people that can do things in terms of improving your sleep hygiene and actually sort of distilling down what the sleep disorder is that can trigger the sleep paralysis. Though it's not always easy to treat, I'll tell you that. It's just acceptable, whatever that, I can't quite read your handle. Say it. Frankie says it sounds great. Okay, good. I'm glad for that. Uh, no YMH today. No YMH per se. I mean, I'm not doing YMH. I mean, the After Dark show is up. It's with Kelsey Cook. Good afternoon. 7 cans of soda a day. Any suggestions how to stop? Like everything else, you got to kind of decide. You have to motivate to stop, and you have to be cold turkey, and then you'll probably wait until you get some sort of you can get a lot of reflux and things like that because the citric acid, the carbonates of drinks can be kind of uncomfortable for your esophagus. I might have pernicious anemia, which is B12 deficiency. That's interesting. Coronavirus update. I think it's more of the same. We're controlling it, and it's going to run its course. And then I heard this. I read some data that suggests there's already a downtick, which means that we may be on the downslope of the epidemic, because all viral epidemics sort of follow a parabolical pattern. This is the pirate ship. Thank you, Josh. Overactive bladder. That's interesting. That might be the caffeine causing that. I don't know what you're asking about with Gail King. You're asking questions about Kobe. I don't know that that's wrong. I'm just reading your questions here. Sorry. High and tight jeans. Yes, thank you, guys. Hi, Blair. What do you guys want to talk about today? I'm a flat Earth shill. Now that is a troller. Very interesting. That's a troll that I can laugh at. Why is taking a prescription drug more acceptable than self-medicating with alcohol? Because if alcohol worked for anything, I would advocate for it. But alcohol is a carcinogen for essentially all tissue. It triggers alcoholism, which is a progressive disorder where you'll progressively lose things in your life, and it has no therapeutic value. I understand you feel better when you drink. That's called alcoholism. That's why people drink, because it works for them, but then it causes all sorts of other problems. Have I heard about China leak about the coronavirus? They're saying there could be 24,000 reported deaths. No way. There's a huge Rick Swinger. Thank you for the note, Rick. Maybe you can distill that down to like a sentence because I can't read it. It scrolls by so fast. I'm trying to read. Everyone seems upset today. So what's going on? Everyone kind of shook up about viruses or impeachments or... My friend has been going all over the country picking up trash. Is it dangerous? Yes, in the sense that you get a needle stick. Again, that's why I'm behind the needle destruction device. He should have one of those. In fact, I'm happy to get him one if he wants to contact us through the website. Plans or goals for the new year? Like I said, I've said it before on this show, is that my goal is, I've had all this crazy experience in my life clinically, and I just want to give it back as much as I can. And so we have these new streaming platforms like this, and it's an opportunity to do that, so I'm going to do more of it. What do you want to talk about being woke? Okay, I'm reading what you guys are saying. How is the coronavirus so different from your standard virus? It's I don't want to say it is a virus that is a little more contagious, a little more hardy. It survives more and spreads more quickly. And in impaired individuals, people with advanced age or immune impairment, it can really cause trouble. It is less dangerous than influenza. Less dangerous than influenza. That's why I'm angry about the way the press is reporting it. So that's my feeling about that. They should be saying, if they want to talk about the progress we're making in containing the coronavirus, they should also be at the same reports talking about what's going on with influenza to alert people, motivate people to get the vaccines. Okay. I'm catching up with you guys. You're way ahead of me, and I'm trying to scroll through. Safe way of taking human growth hormone or testosterone replacement therapy. Yes, I'm sure there are. We don't know the full effects, though there are practitioners that will prescribe both and claim safety and have had good results with it. So you need to talk to somebody who's had a lot of expertise in using it. There is various concerns about testosterone replacement therapy, different in men than women. My case, I have prostate cancer and cannot take testosterone replacement therapy, though I really think Joe Rogan has it right, that I would take it if I could. Thank you, Jill and Kim. One of my favorites so far on the new season is The Masked Singer. I haven't had a chance to really get that female monster is going to be interesting. I think I saw that Drew Carey was unmasked last night, which cracks me up. And he described what it's like to be in those masks very accurately. It really is like that. Ways to deal with self-loathing and overcoming self-hatred. That depends what the source of that is. A lot of people with borderline personality disorder have those sorts of feelings. Also, trauma survivors can have that. Just depression can cause those sorts of symptoms. So, if it's depression, obviously getting that thoroughly treated. If it's borderline, cognitive behavioral therapy. And if it's traumatic trauma therapy. So it depends on the source of that. National legislation for cannabis, I believe it's coming. I believe it will come, and I believe the current administration will be essentially leaving it to the states. I think that's what's going to happen, all of it. So we'll see. Do social media apps create an app addiction? Yeah, they do. There's look up Digital Citizen Academy, DCAkids.org, I think is her current website, and she does. This Dr. Lisa Stroman, is Trohman, has a lot of publications out there and stuff you can read about. It's a problem. Michelle, I'm not sure what you're talking about. That. Thank you for setting the street. My thoughts on Kaylin. She has fourth pregnancy. I can't imagine having 4 kids. Good for her. That's her life. Can early childhood trauma and chronic PTSD damage the brain? No. It is a chronic state of stress. And it does change the wiring in the brain, but it can be treated, so it doesn't damage the brain per se. Good for you with the intermittent fasting. LPC is okay. Thank you, guys. Never took the HPV vaccine. Can I still get it at 28? Absolutely, you can, whether you're male or female. Get that HPV vaccine. Prevents cancer, at least contributes to preventing cancer. I don't know what the 2% lethality thing is you have there. Are you talking about the coronavirus? I think it's less than 2%. It's like 0.02%. Do you want us to come to Cincinnati, Drea? I love Cincinnati. I'd be happy to come. Idiopathic thrombocytopenic purpura. What would you like to know about that? Common condition. Reba asked, why does no one talk about idiopathic thrombocytopenic purpura? We talked about it was lead singer of Korn, Jonathan. Jonathan had it. We talked about it on my show, Loveline, in great detail. ITP is a very common immune attack on the thrombocytes, the megakaryocytes, which are the cells that produce platelets, and your platelets go way down. You can have spontaneous bleeding. Prednisone is the primary treatment, and it's very dangerous, but it's very common and very treatable. ITP. And it can be associated with other conditions too, and that's the important thing, is to make sure it's not one of the other conditions that you have. So people do talk about ITP. I know now that you have it, you didn't you don't hear it if you don't really know it because it's such a strange sounding illness. Okay. What do I think of CBD? I think for some people it's been very effective. I think it's good for pain and some people sleep, maybe anxiety. Not for everybody, and we don't have the data to really know the risk-benefit ratios. I'm again looking through. You're having good questions today. I thank you for that. Would I do another celebrity rehab show? It was so great. Yes, I would. If VH1 or MTV would like to do that, I would be delighted to. There are the number of people I could see retreating. And by the way, we could bring in so many new things. People now understand the opiate addiction, the opiate crisis. We could bring in all the new modalities that we're using to treat that. Meth is such a huge problem. We have ways of managing that. We could bring all these new modalities in and teach people sort of the state of the art right now. Okay. Ooh, sleeping pills every night. Wake up every day at 4 a.m. Can I get back to sleep? Well, that's the pills. I mean, the sleeping pills only last 4 to 6 hours, and then you have withdrawal, and that's what throws you out of the sleep. So you've got to find your way off that. It can cause, some of them can cause seizures when you try to stop, so do talk to your doctor about it. Oh, I think, am I at the bottom? No. I'm getting to your messages. All right. I ran about Forest a few times here in Laguna. Yep, he was there in Laguna a lot. Did I freeze here? No. Thank you, Anthony. We'd love to do it again. Hi from Montana, Vicky. Okay. Should we get vaccinated for chickenpox, measles, etc.? People over 45 probably are covered. Chickenpox, I would talk to your doctor about. If the people that need to be revaccinated are measles, mumps, rubella, so the MMR vaccine, I retook that for sure because of the risk of having been sort of suboptimally treated. There's a certain window, if you were born in the 50s, 60s, 70s, that you really ought to be revaccinated. And one of the ways, what you can do is go back to your doctor and have your titers checked to see if you have adequate measles titers, and if you don't, then get revaccinated, or just get revaccinated. You keep writing, Mag, you keep writing lethality down there, and I'm not sure what you're suggesting is lethal. Yes, Amy, Ziggy Zaggy, that's the man show. This is Corolla's empire here. This is his sort of one of his garages where he has a bunch of cars and stuff. And over here is the studio where we do the shows. You have to. I should take it over there and show you guys. So we'll show you what the studio looks like. I can show you through the control room. How about that? Yeah. So there we go. That is the. Let me see. See it in there? Interesting, right? And this. Yep. Gary, yeah. I'm still doing a stream here, but I'm giving a little tour, and now you're on. Hey, how's it going? Do you want to move into the studio so that I have them stop making noise back here? Oh, it doesn't matter. It's fine. Yeah, it's all right. It's producer Gary doing his job. It's just a good spot to be doing this. Okay. 2.1. Okay, I'm suggesting that what I read in an article is a 2.1% lethality rate for coronavirus. Yeah, I would say that's an earlier lethality rate or death rate from that. Now we have many more tens of thousands in the denominator, so that lethality, that it's like 800 versus 80,000. I mean, do that math. That's the number now. So it's dropping rapidly, the lethality. Or correct me if I'm wrong. I'm interested in what you have to say. Come back to television. We're looking for a home for stuff, so maybe. And be fair, I mean, these days, these environments like this are, in interesting ways, more impactful than television is. Yeah, I caught the Periscope bug. That's true. It's just really interesting to be able to talk to people and interact on a regular basis. If I had double prolapse surgery 10 years ago, what are the chances of having it recur and redone? What is you're talking about? What a prolapse? That's the question. Like a vaginal prolapse. Happy birthday to Amanda. 4 years sober last month. Congratulations. Oh, Amy, you came here and you had a tour with Matt. Interesting. Dealing with narcissistic personality disorder in a spouse. I'd recommend a book to you. It's called Why Is It Always About You? some good practical advice on how to deal with relationships with narcissists. Why is it always about you? Um, yeah, Mag, it's based on 20,000 cases. Now we have what, 80,000 cases, and the death rate's gone up. It's doubled. We've got 4 times the number of cases and double the fatality rate. So just do that math. Um, again, I just think it just seems to me we're going to see more mild disease, more pervasive presence of the disease once we learn about it, and a serious disease. We have to be very, very, the infectious disease community has to take this very seriously. That's their job, but not something the average person should be worrying about. I mean, think about it this way: how many deaths in this country versus 300 million people? What's your probability of getting a fatal coronavirus in a country of 300 million where there's been 1, 2 deaths? Think about it. Thank you, Expert Excavating. I think you're saying you're going to get me on Rogan's, which I would love that. Got off Klonopin after years and would like everyone to know that life is great without them. I am sure of that. That I would not want to go through life on Klonopin. Left a comment in Rogan's podcast. Wait, it scrolls so fast. Okay. Thank you, guys. Bring back Loveline? Yeah, probably not. Probably not going to do that. Adam and I still do a podcast every day. That's why I'm over here, and I also do the Dr. Drew podcast over here. Somebody's commenting that Adam has changed a lot in 20 years. How? Tell me how. Yeah, Mag. I think Mag. Shall I call you Mag, or you can tell me what to call you? I think you're on to the same thinking that I'm on, which is there are probably hundreds of thousands of cases undiagnosed because we only test the people that come to the medical system and are more severely ill. So I totally agree with you. That's been my point all along. In spite of that, 800 deaths, very low. What's the low dose naloxone? Exactly what you're describing. I don't know how to use low dose, frankly. I myself. Low dose people are used for. Uh, oh, there we go. How would we make the podcast better? Maybe some guests. You mean on the streaming show? Sure. The hard part is how do you do the microphone and I guess I don't need earpieces. I just need microphones. So I'm looking for ways to do it. I tell you how I can do it is when I'm at home and not out away. Then I can have guests, and we have them on Sunday. So to be fair, come in on Sunday. We always have guests on Sundays, and we have call in at the same time. I think this week it's going to be on Saturday though. So let me double check that for you. We do the Ask Dr. Drew show, which is just a streaming show like this, but we do it with phone calls. Yeah, we're going to do it Saturday at 3 o'clock. It looks like. So pay attention. Look out for that. Sound is cutting out. I'm sorry. That was the phone. That's because the phone was ringing. I don't think Fed Smoker and RPC should do a show together. No, I don't think so. We're talking about an after dark personalities. At least I like them too. I like being able to interact with people. What time is it now? 3:30. So I got to go do the Dr. Drew podcast very soon. Grendy 64. I'm not quite sure what you're talking about. I'd love to hear what you're thinking. Joe Rogan mentioned the flawed laws that prevent people from keeping letting the loved ones help the mental. Look at my website. I wrote an article for the California Globe. We did an interview for the California Globe with Ramona Russell, and it's on my website. It's just the reviews of things we have to do to be able to help the homeless. That's all. Okay, Josette, I'm going to try to answer this. Do you think my dad passed away from heart condition if he sees, foamed at the mouth and out for 20 minutes and the paramedics didn't make it? Hospital said heart attack. No, it sounds more like heart attack. Stroke usually doesn't cause people to, unless they actually have a seizure. Stroke is a little bit different. This sounds like something sudden where it had, shock. Okay. Thank you, everybody. My dad is going to see a nephrologist. What does this mean? He's 69. He probably has some form of renal failure, meaning the glomerular structures. You have millions of little knots, little tiny arterial knots that are the regions in which that filter at the kidney, and then a loop system that in a very complex way monitors the sodium, potassium, and base status in your blood. And for some reason, diabetes, hypertension, these things stop working so well. And we have to do things to try to preserve the kidney function. And as well, we sometimes have to put people on dialysis. Somebody asked about Mike Cathwood. He's messaging me now. I'm wondering if that's because he's watching. No, I hope not, because he's just used some horrible words to describe me. Oh gosh, you guys, I'm having trouble keeping up with this. Okay. Yeah, I should talk to Joe about homelessness. That would be interesting, wouldn't it? Joe Rogan, that is. I had a skater stalker. How can you tell between enthusiastic fan versus a stalker? Well, this case was pretty clear. He went to small claims court and made a claim that I had put something in his tooth that made him have spontaneous erections. Number one, he was suing me for $2,000. And then number two, he had a website dedicated to murdering my children. So I would call that pretty good stalking. It is difficult. Stalking, the difference between stalking and fandom there can be a blurry line there, but fans are usually good-natured, let's put it that way. Okay, I'm going to just keep scrolling through here. Give me a second. I'm going to have to wrap this thing up pretty soon here, guys. How chronic pain patients can manage without opiates. Boy, that's a complex topic, but there are lots of strategies out there. If I ever meet you, I'm going to spear tackle you into hell. That's Aussie17. I'd love to know why. Aussie17, and I don't know what a spear tackle is either, but I'm assuming that's troll. You guys tell me what you think. 57, hysterectomy at 25. Is it imperative that she have hormone therapy? Hormone therapy is never imperative, and it's different for different women, but it can really improve their quality of life, and it also can preserve their bone, neurological, vascular status. But again, it has to be done carefully and with good thinking about it and understanding the risk benefits. What I'm always saying is if you're going to do hormone replacement therapy, don't leave out testosterone. People often leave that off, and that can be a really important part of the picture. Charlotte asks, how is childhood trauma related to anxiety and depression? It is a universal feature of childhood trauma, anxiety and depression, I would say. And of course, if you're in a constant state, trauma is complicated. It causes developmental arrest. It causes you not to trust people. It causes you to exit the frame where you would enter to learn to regulate your emotions. It really assaults the self, so self-function feels impaired, so you get a lot of doubts about yourself and your well-being and your safety and your understanding of other people's. And because of all that chronic stress and disconnection from certain parts of yourself, of course, mood and disorders and anxiety are part of the picture. Where's my spear tackler? Aussie16, whatever his name was. Thoughts about Mike Starr? What would you like to know? I miss him too. He was a friend as well. So Alice wants to know about Mike Starr. I will tell you, Mike Starr was a guitarist for Alice in Chains. We treated him for long-standing methadone and polydrug addiction. Miraculously, he tolerated abstinence and got into a sober living and was actively involved in treatment. If you remember him, we treated him, I forget what group he was in with, but he was a celebrity rehab patient, and we treated him. Bob worked very diligent with him for about a year afterwards, and he was doing remarkably well. And he was still needing a lot of support and work, but it was a miracle. I mean, just a miracle. And all of a sudden, he came to me and Bob and said, "Hey, I'm moving to Utah." We were like, "Whoa, come on, man! You're just, we're just getting you in the game here. It's just so great. I mean, don't screw it up." No, I'm going to live at a sober living at Cirque Lodge. I have to get my band going again. I'm going to be with a bunch of sober guys. I mean, he made a perfect plan but it still made us terribly uncomfortable. After he went to Utah about a month in, maybe 3 weeks in, he called me and says, I have back pain. And I said, Mike, whatever you do not tell a doctor you have back pain. Promise me you will not tell a doctor. 2 weeks later, dead with benzodiazepine, opiates at the bedside, prescribed for back pain, quickly died of the opiate addiction. And that is how my patients died all the time. Now, you can argue he should have been on Suboxone and maybe would still be alive if we had done that. He had failed everything. He had failed methadone, he had failed everything. And so we had tried all that. And he was doing great. But again, my peers killed my patients all the time. Jeff Conway, virtually the same story. Even more complicated, more heartbreaking. All right. So it's crazy that somebody with long-term addiction, early in sobriety, and a doctor hands him benzodiazepine and opiates. It's just too much for me. I'm getting through okay, guys. All right. I guess we lost that Aussie dude that wanted to spear tackle me. I was very interested in. I'm interested in trolls and seeing what motivates them and what they're really thinking. People want to know about Dunning-Kruger. Dunning-Kruger is an awesome syndrome that is alive and well today, like never before, which is essentially a cognitive distortion that causes you to believe you're better at something than you think you are, or you know more than you think you do. It's based on, they think, lack of exposure or education. It's how people can get up and sing like hell on American Idol and say, "Look, wasn't that great?" So, okay, so keep them high and tight, Cat. Thank you for that. That's all to your mom's house, folks. Okay. Mike, don't say that he took more than he should have, called being an addict, right? No, I don't know they took more than he should have. And by the way, we're talking about Mike Starr. He might have taken he's an addict, so he will naturally take a little more than he's supposed to. You might have taken virtually as prescribed, but the two is a lethal combination that was routinely prescribed: opiate, benzo, lethal, and so that's the problem. First step, figuring out if you are depressed. Talk to a doctor about it. If you're thinking, am I clinically depressed? I mean, there's a high probability something like that is going on. Down to 1/4 of a Suboxone a day. Should they just stop altogether or stay that pace since it works? 1/4 of a 2 milligram, that is essentially nothing. So I think I'd stay with it. I mean, why, it's not going that level of Suboxone is not going to impair sobriety. It's not going to stimulate addiction. So if you can get by with that, and you feel like it's helping you, and you feel withdrawal if you try to stop, I'm fine with that. Milligram or below, I'm fine with it. Though I've had patients that really struggled with that last milligram and felt very bad about it and really wanted to get off it and eventually did, and did feel better when they got off it altogether. So it really depends on your case. You need to talk about it with the doctor very carefully. Do I want to go to a show in Hollywood tonight? I would love to, but I'm going to be doing podcasting here at the Corolla Empire, so that's why I'm here. So I appreciate that. Why so much thyroid disease? Because thyroid diseases are very, very, very common. They have always been. Why do you feel Dunning-Kruger for some things and imposter syndrome for others? Dunning-Kruger and imposter are sort of the same thing, right? One is you know so much, you know how much there is to know, and so you feel kind of like an imposter, like you should know more. One is the flip side is you don't know enough, so you think you know a lot, and they are flip side of the same coin. Okay, guys, we've done a bit here. I'm running out of power in my headset and my computer, so I'm going to wrap it up. I should, let me double check, have time to do this again tomorrow. And of course, as I said, we will be here on Saturday. And let me double check. I think we're doing, as I said, let me look at tomorrow though first. Yeah, I should have time tomorrow afternoon, and then Saturday at 3 o'clock Pacific time, we'll do our call-in show. Okay, very quickly, I'm seeing what you guys have put up here. Oh, Melissa, I don't know what you're talking about with the brain fog and the muscle weakness. And somebody asked about running for Congress, which I am not going to do now, but I might at some point. Okay, guys. Thank you very much. Thanks for being participating, and I'll see you tomorrow.